Hello, everybody.
Hey, guys.
We're here at Renew, and we are wishing everybody happy holidays. It's the first day of Hanukkah tomorrow.
Oh, yeah,
Yeah,
that's right.
Festival of Lights. So, happy Hanukkah to everybody tomorrow. I'm going to be lighting my candles.
There you go.
And then I think we know the rest of the things coming up, and it's flying by. Time is flying.
This year
so
has been
no, we're
a long one.
No, we're not talking that way because
It's
you
true.
know what? It's been a long year. Yes, it's been a very challenging year.
For sure.
But at the same time, I think there's a lot of really good things that happen.
Oh, absolutely.
You know,
For
there's,
sure.
I think, as a practice, I think we've had really good things.
I think as individuals too, we've been able to focus on what's most important in life and family and health and, spending time with our loved ones, which we, maybe sometimes get all caught up in the hustle and bustle of life and we forget to do those things. So
Or
it is
took it for
definitely-
granted,
or took it
that
for
we
granted.
can't hang out with them sometimes. So, I think everybody's like ready for this year to end, but it's gonna be a memorable year, that's for sure. But I think there's, you're gonna look back and I think you're gonna see some good things that happened.
Absolutely.
There's a lot of COVID babies being born right now. And if you know anybody having
Not
a
in my
COVID baby,
household. COVID babies are the ones that are not being quarantined with babies.
Yeah. Yeah, but if you know anybody having a COVID baby, we have a great, our little tablecloth that you can sign for every year of their life, and you can get them at our office, and they're a really cute gift if you're a grandparent or a parent out there, and every year you bring the tablecloth out. But anyway, so
all right, let's get into the other fun stuff.
This stuff.
And I'm gonna take my reindeer ears off.
Yeah, it's time to take these off. They're fun. We'll put them here on our bad eggs. There we go. Our little raffle.
Backwards?
Probably, yeah. And Marty's so picky about stuff. Okay,
Never.
so, no, it's not backwards. I'm right.
No, mine I think was backwards.
Okay, we're good. We got it going on today. So, you are tuned into Renew Medical Aesthetics, and I'm hoping in January that we will have this theater filled with people, but we'll see what happens.
Yeah, day by day.
Day by day. I want to remind everybody about our giveaway. Okay, so our giveaway, to do it, you have to follow our page, like our post, watch our seminar, which obviously you're doing right now, and tag 3 friends. And if you do these things, you're going to be eligible to win either one area of Xeomin, which is like a Botox agent, or like a frown area, crow's, or forehead, or our beautiful eye cream from Neocutis, which helps to tighten, smooth, and brighten. It's like, hands down, eyes open, the best eye cream out there. For sure.
Never was a believer in eye creams until this one. So
See, that says a lot right there. So don't forget to do that right now, because some people get on there, but they don't tag 3 friends, and if you don't do those, all these things, you're not eligible to win. So get on it.
That's right.
All right, so that's our background. What about us? We're crazy.
We have fun.
We have fun. We enjoy life. We love what we do. I feel like we live in our little Renew bubble where everybody who comes to see us is happy and things are good, they're healthy, and it's a great place to be every day. The things that, over and over patients tell us about make us different, we're safe about everything. We're not going to do things that are going to put you at risk. In fact, our client tonight, our demo tonight.
We were supposed to have a model, and
right.
she ended up having a reaction to the numbing cream, and which happens from time to time, but she just felt really uncomfortable, so we just decided, you know what? It's just better to not proceed with the demo. We'll reschedule at a later time. We never want you to feel, pressured or uncomfortable in doing anything. We want to make the experience a good one and a memorable one, and we want you to leave here completely happy. So.
And I think that's different. There's so many places on every corner that do this. Botox, fillers, So being safe and listening to our clients and doing what's right for them is what we always are gonna do.
Yeah.
It's not gonna be about the money or the filler or, getting you out the door. We're gonna do the right thing. So that was case in point. So obviously we don't have a live demo. We're probably gonna bring her back and inject her, and we'll be putting it on a video for you.
We'll share
So,
that with you guys.
it's always nice to see it done. So honesty, we're very natural about what we do. The other thing, I think a lot of people are afraid because they don't want the big lips or the big cheeks, or, they don't wanna look different, and we just make them, we turn back time for them,
Absolutely.
the young girls, sometimes they do wanna correct things that they, feel like they need
Yeah.
more of a chin or
Right.
a top lip, that's different, we're making them look natural still though. So those are things that make Renew different. So tonight we're gonna be talking about our Renew Lift, which tonight is gonna be with Radiesse, Belotero, and Xeomin. So great combo. This is always one of our very popular seminars. I do a ton of Radiesse. Radiesse is my
It's our workhorse
big
here.
workhorse, yes. With these products, we can give you a really nice Renew Lift. And what's a Renew Lift?
Well, I would say most of our patients, our older patients, they come in and their biggest complaints is their, smile lines and the jowling. So with Radiesse, we're really just able to kind of lift everything back up, again, kind of, age in reverse. We're able to also utilize this product in various different ways because it's biostimulatory, so meaning it's going to stimulate your own collagen production. So we can use it to help, with texture, skin laxity, and all of these, problematic, problems that we suffer with as we get older. So it really just, we can use it in so many different ways. And then of course, with our Xeomin, we want to help reverse those dynamic lines. We want to relax them a little bit so they don't really start to get etched in. And we do that with Xeomin by relaxing those muscles so that not only are we lifting everything up, but we're kind of relaxing and just giving a nice youthful look to the face.
Yeah, it's very natural. I mean, we talk about the things, and I'll talk about aging in a minute, but we use these combination of products. It's not really the product itself, although, everybody's tuned in Radiesse because I've used a lot of Radiesse throughout the years, but it's really not the product, it's how you do it and what you're, somebody else could take a syringe of Radiesse and it could be a nightmare. It just depends on where you're putting it, how you're doing it, and understanding the aging process. So we do that.
I love the analogy that I've heard used quite a bit. It's like you can use a paintbrush or the best paintbrush set and give it to a very skillful artist and get a beautiful painting. But then you can give that same set to somebody else and not yield the same result because it's not so much about the tool, but the one holding the tool. So.
Right. So we're educating you about the tools, but at the end of the day, I mean, if you see me next year, you see Jamari next month, we may have different tools to get you to the same place. We're always getting educated. We're always, doing, changing things up. So it's really not as much about the products, but we do want to explain them to you tonight. So this is just talking a little bit about what Jamari's kind of been talking about. You lose fat and in different distributions in different areas. You lose bone. These are your supporting structures. So whenever anybody says it's gravity, it's really not. That number never changes. I hate to tell you, but the number that changes is our age, and with age, we lose our supporting structures. So it's kind of all about that. And many of you have seen this before, but it's my favorite way to explain to you what we're doing. So we talked a little bit about the Radiesse and biostimulation of it, and it's really exciting because, I've been using this product for, I think we pulled up, I have at least 800 patients that, we inject with Radiesse. Using it for over 15 years, and it sometimes gets a bad rap about being safe or not safe. It is very safe in the right hands, but it is the only product that's going to give you an instant gratification and is going to stimulate your collagen, which is really what it's all about. It's all about stimulating collagen. But now what we're doing is we are also diluting this so we can use it on the body the same way. So it's kind of fun. Or the face, just to smooth things instead of volumize things. So somebody might have great volume, but, you know, their skin is a little
Maybe a
lax
little
and
texture,
crepey.
yeah.
Yeah, so we can do the textural changes with that.
It's a very versatile product, so
Yeah,
there's
it
a lot of
is.
different ways that we can use it.
It is, and Sculpture is the other biostimulatory filler, but it's not really an exact
Instant.
filler. It's really more particles that are in there stimulating collagen, which is also great.
Yeah.
But the reason I always put Radiesse on special in December is because holidays, usually we're going to parties. Not as much this year, but you know, I think people are still getting together and caring what they
Yeah.
look like on Zoom.
Mm-hmm.
So it does give you that instant gratification and collagen building,
At
and
the same time.
it's
Absolutely.
amazing. So, and we just talked about that it can be used on the body too. It is, I always call it a heavy lifter. It's the best product for lifting.
Yeah.
And don't forget, if you have questions, you know, we also are judging you on your interaction with us, so you wanna win, gotta talk to us, ask us questions. Let's go through a few pictures. Why don't you explain though first, when you're coming in, since we're not doing a live demo, patients coming into you and they're doing a renew lift with some Radiesse. Go ahead and talk with us about what
Like the
that's gonna.
consultation process, or what the
Right,
actual
what the
injecting
injecting is like, because, you know, I think that's important for people
Yeah.
to understand.
I think, you know, there's probably, especially for our newbies, there's usually a lot of like fear and apprehension. I know like this patient that was supposed to be our model today, this was her first time, and you know, it's a lot of nervousness, but truthfully, it's really very simple and straightforward, and usually very, you know, very quick process. So I personally sometimes, you know, like to mark up the face a little bit. It just kind of gives me a little bit of a better idea of where, you know, that patient's highest points of their cheekbones should be, and just kind of to help direct my eye a little bit. And then from there, you know, we slowly start injecting. We inject very slow, that way it's very comfortable and, you know, to help minimize bruising and things like that. But the injections, they go right above your bone, and this is why we're stimulating what was there before and just trying to recreate what has been lost with time. So we go right up along the zygomatic bone, and again, just recreating that arch back and that support structure. A lot of times too, we tend to lose our jawline, and we start to notice that our neck and our face becomes very seamless, which we don't want it to be seamless. We want some definition.
Right.
So we, you know, do a little bit of injection points right along the mandible too. And again, this is just, we're recreating what was already there. You know, we're not altering, you know, your face, we're just restoring what has been lost with time.
Yeah, and I think that's an art to that, because
Absolutely.
you know, if somebody, there was a time, you know, when people started injecting in the what we call the mid face,
Yeah,
where everybody
apple.
was getting like big chipmunk cheeks, and it just was really turned a lot of people off. And you know, it's really important about the way we inject. We really follow your own facial structure. So no
Right.
matter what that facial structure looks like, you're gonna walk out of here looking what you know, like what you looked like. You're not gonna look like somebody else. It's
Right.
gonna be very natural, and it's because we follow your anatomy. We pay attention to the
Right.
anatomy.
Absolutely.
And it's actually really comfortable, because you know, we're going straight in, and your nerves are only at the surface of your skin. They're not down deeper. So once you get past the skin, which is numb, you don't really feel it.
I have most of my patients that say it's actually more comfortable than Botox.
Oh yeah, because we do the Radiesse first, and then we, you know,
Yeah.
most of the time people are doing both the same day. Do the Radiesse first, and then you know they're fine, and then you get up here and they're like, oh, ooh, yeah, because they're just used to this being really comfortable.
Yeah.
But the other thing I always tell patients is, you know, and you're young, so you don't do this, but do you ever do this in the mirror?
I do it. What do you mean?
You better not be.
I do like here. Like this is.
Yeah, so this is, you know, we're in the office, that's what we're doing for you. We're doing just what you do in the mirror, except we're making it stick
Stay.
and last. And that's how it works with the Radiesse. So here's a couple pictures. You can see the corners of her mouth are down a bit. You know,
These nasal
she's,
labials.
yeah, right here. People come in and they say, oh, my nasal labials, my marionette lines, or even just this and this. And really, these are symptoms of
The
this.
disease.
It's basically the volume loss here, and it's causing these symptoms. So if we lift these up, these can, you don't want them to go away, because I want you to look around at little kids.
They
Little
have 'em
kids
too.
have nasolabial folds.
Yeah.
When you get them gone like that, it
It's
really does
unnatural.
not look natural. It's
And I always
Not
tell
good.
people, my patients too, because we do have patients that come in, I'm sure, most practices do, where they just want this corrected. And you will have injectors that will fill this without correcting the problem. But again, like we said, this is the symptom, the disease is here. So what starts to happen if you just continue to add volume here and add volume here, now you start to have this very unnatural appearing look
Yeah.
and almost like this heaviness and like a monkey look almost,
the monkey,
because
yeah.
it's just not the way your anatomy was to start with. You're masking, you're putting a Band-Aid on what's actually going on. So
Yeah, and I think we're seeing less and less of that,
Yeah,
because
it's
I
gotten
think more
better for
injectors
sure.
are really getting educated about how to do
Yes.
this. But in our practice, this is how we've always done it. I don't remember the last time I just filled somebody's nasolabials.
Yeah.
I mean, it's been like maybe 15 years.
any other questions?
All right, so we have a handful of questions about
Okay.
Radiesse. All right, so they want to know, like, how long does it last? How long does it take to see the best results? What are the most popular areas to get Radiesse done? And also, can it be touched up after you do it,
Somebody wants the prize.
No, these are different
I
people.
like this.
Yeah.
These are all
All
actually
different people.
all different
Perfect,
folks
perfect.
asking great questions.
Okay,
So how long does it last?
How long does it last? I tell people the product itself lasts for 12 to 18 months, okay? But it's like completely gone. Most of my patients are going from 8 to 12 months because, once you're corrected and things start going away, you don't
don't
wait
wanna go
for it to
back
go
down to
back
ground
100%.
zero.
Right, exactly. So 8 to 12 months is the answer to that. What's the next question?
What are the most common areas that you treat? I would say probably the most common area that we treat is going to be like the cheekbones and the jawline. I would say after that, probably, maybe like the neck. I would say.
Yeah, neck wash.
Neck wash.
I would say that face is probably,
Our
it's
number
like
one for sure.
90% of the time. And then we can treat, the neck, the décolleté, knees. I'll show you some of those
Hands.
pictures. Hands,
Butts.
butts. It's really,
It's gotten popular now.
Yeah, Radiesse is really versatile.
Yeah.
I mean, these are different types of treatments, and actually next month we're going to be talking about bodies, so we're going to be getting into that. And if anybody out there wants to be a butt model, we are
Yeah,
looking
let us
for
know.
a butt model. So, just give us a call, DM us. We really, are looking for somebody to do that. But
The
what was the other question?
when do you start to see your optimal results?
Right away. Walk out of the office, looking great right away. You're not going to look different. You're going to look refreshed. You're going to look younger. Your eyes are going to look better. You're going to look happier. And it's going to take, it takes about 2 weeks to really, I think, to be optimum.
Yeah.
But you do see the difference immediately. That's why it's very popular, because usually when a new patient, especially by the time they come in to see us, they're ready for a change right then and there, and
Yes.
that's where Radiesse is like, yes,
Yeah.
let's do it. Let's do it, and let's do it right, because that is the way.
Yeah.
And, we usually give the transformation form. We'll say, for complete correction, it may take you anywhere from 3 to 6 syringes, okay? But don't get scared, because, a lot of times we don't like to do more than 3 at a time, because you do get some swelling with it, and that's something that, about 48 hours goes down. But we like the product to settle in, and that's a unique property to Radiesse too. It really integrates, it like mixes in with your tissue, so it always feels like you. It's not like you touch your cheeks and go, oh, I have something in there.
Right.
No, it just feels natural.
Yeah.
So, but about 2 weeks to be optimum, maybe 3, but immediately you see your results. So I think, did we get them all? Got all that?
No, there's more.
Okay,
Alright.
let's go. I love it.
Yeah, is there any bruising is it good for bunny lines? What will Radiesse do for buttocks?
Okay.
Can you reverse it? So,
Great
Yeah, so,
questions.
wait, what was the first one now? Can you use it where? Oh, is there any chances of bruising? That was the first one. So, I mean, absolutely. I always tell patients, I will be completely honest with you, if there's an injector out there that's promising you no bruising, they're lying to you. Because there is always a chance, if we're poking your skin with a needle, there is always a possibility of bruising. I would say most of the time it's fairly minimal, but we can't 100% guarantee no bruising. It's just not feasible.
You can do things though to make it easier on
Minimal.
us and you.
Yeah,
You know,
absolutely.
stop your fish oil, stop your aspirin, don't take an ibuprofen and leave. Da da da.
Try not to
Vitamin
drink
E.
alcohol before.
Yeah, no alcohol. I don't know. It's
20. Vodka Val says it's okay.
So, you know, those are the big things, but, you know, then we have arnica tablets that you can take, you know, put them under your tongue, we put arnica cream, we have a infrared light that we put you under afterwards, and then when you still have a bruise, we have the best concealer in the world. So, we have all these things that can help, but I'm sorry, you put a needle in your face, and these are deep, I mean, they're kind of almost blind sticks. You know, you can get a bruise.
Absolutely.
Like she said, people who say that, oh, I never bruise anybody, well, then maybe you're not injecting enough people, I don't know. You know, so.
You got some kind of magic.
Or you're living in a strange world, I don't know, but.
And then I think the other one that I remember, and I'm just gonna, cause I still have it in my head, is does this treat bunny lines? So, no. Radiesse is a filler, so it's not going to treat bunny lines. The bunny lines are actually stemming from your nasalis muscle, but Xeomin will. So again, that's just where we're, injecting right into that muscle, relaxing that muscle, so now we're not able to create those dynamic lines.
And if you have a deep static bunny line that maybe needs some filler, you can put a filler there, but it's gonna be a very thin one. And Radiesse is a heavy lifter, it's a thick filler. It's not okay to put there. There was a day when I would put Radiesse on the bone there to fill. These days I wouldn't. It's just it's a dangerous area to put. It's a dangerous area just in general. So if you want to put something there, it's got to be more of a hyaluronic acid. Belotero that we're going to talk about is awesome for those lines. So let's say you put Xeomin in, you relax the muscles, but you started out with a big old deep line driving a truck through there. You can put a little bit very carefully and, in multiple visits, you can put a little bit of it there to smooth it, and it does a great job with it. So you can do that. And reversibility. So that's something that has been, I think, an issue with Radiesse since day one. So hyaluronic acid fillers like Restylane and Juvederm, Belotero, everything like that, they're all reversible. There's something called hyaluronidase that it's an enzyme, goes in there and it reverses it right away. So, the other companies have always said about Radiesse, well, it's not reversible, it's dangerous, da 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 da. Well, I've been injecting it, like I said, for 15 years, and a lot of it has to do with the area where we are injecting. We're going down deep on bone. It tends to be not as many vessels. It's slow. And you're careful. If you need to reverse it, you can actually. We are able to do it with just saline solution. I had a patient who had some Radiesse nodules, and I was able to get in there with saline solution, and they all went completely away. And it's just not common. I mean, in 15 years, I think I've had nodules from Radiesse 3 times, I think, maybe 4. I mean, it's just really not that common, but we do have that. There's also something, is another chemical that you can inject there that actually disperses it and helps too. So there's definitely options. So you can take care of if you have any problems. But the best thing is prevention, so to inject safely. And I think, and knowing that if there are problems, you know how to handle them.
Right.
That's
the biggest thing.
It is, because you inject enough, there's going to be problems.
Absolutely.
Nothing's perfect, so you just have to know how to handle everything. So we've got a patient here who, like I said, she's gotten. What I want you to look at is under her eyes there, because a lot of people come in and they look tired under their eyes. They want to do filler, But until we do filler, until we do the cheeks and lift them up, a lot of times people don't need filler under their eyes. So we can lift here and you can see that she did great under her eyes.
Yeah.
She didn't need any filler. It was just these supporting structures that are lax.
Weighing you down.
Combination therapy, something I love to talk about. So, when you come in, you're not gonna just get one syringe of Radiesse or one syringe of Belotero or a little bit of Xeomin. I mean, you might start with that, but you don't age in one dimension, you don't age in one way, so why would you be able to be corrected in one way?
Yeah.
And
honestly, at the end of the day, you're gonna be the happiest if you do your complete correction. If you come in and you only want one syringe of filler, I mean, sometimes we'll tell our patients, you know what, come back when you can afford, the 2 or the 3, and that way we can really give you your complete correction, and that way you'll be really happy. Because sometimes, one syringe is just, most times, one syringe is not enough.
no, no. It's very little product. It's 1.5 cc's. It's this much. So, the thing is too that we'll always go through a transformation plan. So you might come in and say, okay, it's my marionettes, but we're gonna look and tell you, okay, you need to get lifted here, and maybe you have horrible sun damage. We can lift you, but then your skin's gonna look awful, and so we have to address that. So we have the laser that addresses that. We have the volume that's gonna lift you. We have the things that are going to smooth the lines with the Belotero. We have the Xeomin that's going to relax the muscles so it prevents deep lines or softens deep lines. So all these tools together are what makes a happy patient.
Absolutely.
And what we call complete correction. And we'll give you that transformation plan. And a lot of patients, okay, where should I start? We give you, here, start here. Then they come back, okay, what next?
Yeah.
Right, let's go here. It may take somebody a year or two to get completely transformed. Once you're transformed, then all you have to do is maintain.
Yeah, maintain is easy.
It's easy. So we do recommend that don't try to sit at home and go, okay, I'm gonna have one Radiesse and I gotta have some Xeomin. Come on in or call us and we'll do a virtual consult, but a consult just to get your transformation plan and pricing and that way then we'll be able to go from there. We've got our secret code up here.
Yeah.
So we do have, if you get, call with the secret code within 24 hours, you'll get 15% off the Bello, the Radiesse, the Xeomin. So
It's good.
it's good. Oh, and a microtox, which I'm gonna talk about a little bit too. So that's a real instant gratification. So Holiday Lift is our secret code, and I'll put it up a couple times. Holiday Lift, Holiday Lift. No, we're not crazy. So here's another patient, her Radiesse and her lips. So lips are a great way to really perk things up, and we do a lot of that. Radiesse for the lift, and then lips.
Yep.
Really,
I feel like we talked
beautiful
about this
transformation.
before, but lips are just an area that people are so afraid of. But we lose volume in our lips too, and sometimes you are so lifted and everything looks great here, but then you still kind of look a little bit aged around the mouth area. And when we finally convince them, just let us get in there and get a little bit of volume back. I mean, they're so happy. And why did I wait so long?
Exactly, though, and I like Belotero for those patients that are super afraid. Even if they need more volume, Bello is a great way to start. I actually have a little Belotero on my lips. It just gives a little hydration, a little definition to the lip lines. It will treat the barcodes. I'll have a picture of that a little bit later, but I love Belotero for that. And then we can go up from there. We have other products that are a little, thicker and give you more volume, but this is always a great combo. This is a patient with 2 Radiesse and nice little lift, you can see again under her eyes. Looks like she had volume put under her eyes, but it was just
the Radiesse.
Yep, augmenting her cheeks. So she does still have some nasolabial folds. We can put other softer products in there to help. So it's a step towards more complete correction, but look how much happier she looks and refreshed. Amazing.
Absolutely.
Amazing. So this is Radiesse, Restylane, Define, and Xeomin. So again, we've smoothed out lines, we've lifted her up, we've treated her lips, and we've got some great results there.
Yeah,
Complete
she looks
correction,
gorgeous.
you know, complete correction. I think actually she had a laser as well. You can see how her skin
Yeah, her
is so
skin just
clear.
looks
Yeah,
much
she's
better.
definitely a nice combination therapy. So we were talking about the knees, body. So I like to call it our Renew Body Shop. We have a lot of things we can do to the body, and again, next month we're gonna be talking about
Yeah.
that. Oh, somebody had asked, what can you do with the butt? So, Radiesse in the butt is actually going to help smooth, like cellulite dimpling. It's going to stimulate collagen, and you actually can get a little bit of lifting. So it depends on the amount of product that you want to put in there. It does take a little, you know, a fair amount of product to do it, but you can get some really nice lift. Like somebody has a hip dip, we can put it in there. You can do either with Sculpture or Radiesse. The nice thing about Radiesse is that you do get the immediate,
Instant.
you know, that's, you know, a lot of people are impatient. I always call it the impatient patient. You know, so a lot of people are impatient, and that will give you your immediate satisfaction. So again, we need a butt model. But these are knees, and this is funny. I won't tell you who this was, but she didn't think, you know, she didn't think she needed
had
this.
any, yeah.
This was like a demo. She's like, okay, I'll do it. And look at her results. They're
Yeah, it's
amazing.
amazing.
Actually, Radiesse took those and they're
Yeah.
using them to publish, you know, their results of the
She didn't think
Radiesse,
she
but-
had any results too.
Yeah, exactly.
I find that very common too, like sometimes patients come and they have treatments done, you know, like, you know, something like this, or their hands, or a neck wash, and they're like, well, I don't know, I didn't really see too much results, and then we put their pictures together, and they're like, oh my gosh, I looked like
Yeah.
that before.
It's incredible. I mean, that is a very common occurrence. So
Yeah, you look
when-
at yourself all day, every day, so of course you're not gonna notice these subtle changes, but
Yeah.
that's why, you know, the pictures are so important. I know patients come in and they complain about the
Yeah.
million pictures too, but it's, you know, the proof is in the pudding. That's where we have the best comparison to really show you, like, no, look, this is working, and
Think
look
about
how amazing it's
think about
working.
it when you have a child, you know.
Yeah,
How many
you
pictures do you
forget.
take of this kid? You take pictures every day, and you can look at a picture a week later and go, oh my gosh, this, you know, it's grown up, and look at, you know, he's changing so much. If somebody's changing like that in front of your eyes, you don't tend to see it unless you see the comparison.
Right,
So, yes,
Absolutely.
we're always gonna take pictures. Sorry, you can't talk us out of it.
yeah.
You know, the other
And
thing
for
is,
yourself too,
Yeah.
like, you know, it's not really, you know, I mean, it is for us too to see, but it's more for you so that you see also your, you know, your journey, how far you've come.
I always say people forget what they used to look like even 10 minutes ago. You know, because with Radiesse, it's like you just within
Yeah,
10
instant.
minutes you look different. So I always, you know, show, I think you do the same thing, half and half,
yeah.
because if you finish the whole thing and have them look in the mirror, they're like, what'd you do? I don't see
Yeah.
anything. But it's just because they look like they used to look, and they forgot that they,
Yeah.
in between, had aged. So, anyway, so body, we got the body. So Belotero, any questions about Radiesse? Just, you can throw them out there. We're gonna move on to Belotero. Belotero, we talked about a little bit. For the lip area is fabulous. The other area that it's the only product I use is under the eyes. So when people have like hollowing under their eyes, the tear trough area, I use Belotero because it's safe, it's thin, it's going to integrate well. It does a great job. And I have a couple different techniques I use to fill under the eyes. And it's a really,
Just gives nice results.
really nice product for that. So after we've lifted your mid-face, if you still need some filling under the eye or even smoothing under there, we can do that. Usually I will recommend a laser first though, because most of the time people have that loose skin
Flat
under there
skin,
and they
yeah.
need the tightening first. But this is, you know, Belotero is quicker, it's more immediate. So a lot of people do the Bello first and then they do the laser after that. But it does a great job. This was a patient, one of my first patients with Bello, and she had to talk me into this like over the years because it was an area I just never wanted to do. That she was young, she didn't need it. Then she finally did it. I said, okay, you were right. You were right, you needed it. The barcodes, like we talked about, and around the lips, so very subtle. I mean, if somebody's afraid but they need something, Necklace lines are great. So just like the edge line over the nose, if you have edge lines in your neck, you can use the Belotero in there. It just smooths those lines out immediately. So the neck wash, why don't you talk about what that is real quick?
Yeah,
with
so the neck
Radiesse?
wash, like I told you with Radiesse, it's such a versatile product. Oh, I'm brain dead. It's a very versatile product, so we can use it to have that really good, robust support system, but we can also dilute it a little bit and use it more for its biostimulatory properties. So with the neck wash, we dilute it a little bit, and we actually, with a cannula, just kind of work it into the tissue all around the neck. And what it's going to do is it's going to start stimulating your own collagen production, and it's going to make the texture, laxity, and all those lines just start to improve with time. So sometimes patients need more than one treatment, but it does work really, really well.
And then if you still have that deep edge line, you can put
come in
a
with the
Belotero in it. But this one actually did well,
Yeah.
with just that. But a neck wash would have been nice on her too. So this is about Xeomin, and Xeomin is a Botox alternative, and I think most people know about that kind of thing, but what they don't know about is the different areas you can use it in. So, we can treat a gummy smile, we can, try to lift the corners of the mouth with it, treat the neck bands with it. We've been doing a lot of, I think I talked about this last time, massing our muscles because people are clenching their teeth from stress. And you can put that in and it relaxes the muscles, but it also kind of
Slims the face,
debulks the face here a little bit. So just all these different areas that we can do it. And there's prejuvenation, which is the younger ones who are doing
prevention.
it. Is it ever too early to start Botox or Xeomin? Well, I guess maybe at age 10.
Yeah.
Although I think there were some little child models who used to get it. But what I always tell my young adults is the second you start seeing a teeny little line there at rest, like a faint little line, is a great time to start.
Absolutely.
Now, some of them start even earlier if they just don't like that they even can make
Can
one
make
at
that
all.
expression.
But it is preventative at that point.
Absolutely.
And we use tinier doses. We call it baby Botox or baby Xeomin. And,
It's
I
just
think
smaller doses.
it works great.
It's funny because people always tell me like, oh, you're too young, you don't have anything. Well, yeah, I don't have anything because I do my Botox or my Xeomin. I've actually been using Xeomin more, I love it. But I went back and I even showed Dr. Barrett some pictures of me when I was 27, and I had some deep lines here. It just, I'm a very expressive person, so,
And that people always worry about that too. Like they say, well, you know what, I don't want to be frozen. I want to be able to express myself. So, yeah, Jamarki is very expressive
I'm very
still.
expressive.
Yeah.
I always tell
still
people, I'm
express
like, my
myself.
Xeomin saves me sometimes from getting in trouble. I can't make it too aggressive. But I think I get across my whatever I need to with my expressions. I can still raise my eyebrows and make my angry face. It's just not enough where it's, leaving nasty lines behind.
Right, exactly. I mean, it's perfect. Yes.
Yes. What is the main difference between Xeomin and other
So
Botox?
there's, I always say between the three, so Xeomin, Botox, and Dysport, and then there's Jeuveau, which we don't really carry, but they're all the same drug. They're all the same drug. They're just different types of formulations. But where Xeomin stands out, and it is actually one of my favorites too, it will kick in quicker, and I like it because I'm usually late to the party, so by the time I remember I need it, it's kind of like I need it tomorrow. So it does kick in for most people quicker. It's a more pure protein, so it's less likely to cause antibodies. When now we're going on, been at least 30 years, at least 20 years when we've been using it cosmetically, and over time people could develop antibodies to these products. So it is least likely to develop antibodies. And I always say I recommend all my patients to try them all and see what one you like better. If they all work the same for you, then use whatever is on a better sale that month. But it is cheaper than Botox is, so that's nice. So if it works just as well, then why not? And then you get the other benefits of it. So Gwyneth Paltrow is the
new face of Xeomin.
New face of Xeomin, and there was just that post that with who was it that said, that she's never.
J-Lo.
J-Lo said,
I love me some J-Lo, but come on, J-Lo. Come on, girlfriend. You don't have to hide about it.
She said, I've never
I'm not that girl.
I'm not that girl.
I'm that girl.
Gwyneth Paltrow is that girl. We're in the Me Too.
Me too. I'm that
You're
girl.
all probably that girl. So what? We all look gorgeous.
That's right.
Right?
There's
You
no
know,
way
and
she
J-Lo
looks that
looks
good
gorgeous.
just from olive oil.
Well, somebody said that maybe she doesn't because she had the ponytail facelift, and that's why. So, maybe she doesn't need it, but you don't have to throw us under the bus.
That's right.
It's no judging out there.
Absolutely.
I don't judge for anything. If somebody wants big lips, they want big lips. I'm not judging.
To each their own.
Each their own. So let's talk about how to get your instant holiday glow, and that's with our
Yes.
Microtox, which is Renew proprietary.
Yes.
Jamari just did one today.
That's right. It's just it's like the red carpet facial. It's gonna give you an instant glow, dewy looking skin, hydrated skin, plump skin, with no downtime. So it means like you can come get it just before, a party or an event, and your skin is just gonna be completely glowing. So
The nice thing is too, it really lasts for like 6 months. It gives you, we're using hyaluronic acid, we're using a neuromodulator like Xeomin, we're using a growth factor serum, and then we're using really tiny needles, so we're putting it very high up in the dermis, and it's just going immediately in there, so you get your instant glow with the hyaluronic acid. You have the neuromodulator is going to work on your skin to kind of tighten pores and makes your face feel a little more tighter and firmer.
yes.
And then the growth factor is going to stimulate your collagen, and even just the little needles are going to stimulate.
Absolutely.
So it's like immediate gratification, and it's going to last. So that is also on special today too. So it's a easy treatment.
Yeah.
No downtime.
Yeah.
Instant. What's not to love? So with the holidays, we do have gift cards.
Yeah.
And if you can't figure out what to get somebody, it's really easy on Instagram and Facebook or our website. There's a link, and you can click on that and just right away go ahead and get it, and then your loved one gets an email. It's a really, I always say easy is great. A lot of people don't want to be out shopping, so
Absolutely.
if you do get for every $200 you spend, you'll get a free NeoCutis eye cream with it, which is normally it's like $120, I think, $115.
Yeah.
So we have a little benefit for that. And then I want to quickly tell you about our client appreciation party slash fashion show, which is going to be right here in our theater. And in the building, it's going to be a little different this year, so stay tuned for how that's going to be different. But it is on February 26th, Friday, and we do it every year. We have live entertainment. It's fun. With COVID, it's going to be a teeny bit different, but it's going to be even better. And the fashion show is new, and we do like a raffle every 30 minutes. It's really fun, really fun. So Audrey will be there. So our specials tonight with the secret code Holiday Lift, it's 15% off Xeomin, Belotero, Radiesse, and the Microtox.
Yes.
So you have 24 hours to DM us, you can
Call the
email
office.
us, you can call the office, you can leave a message on Facebook Messenger. Any way you can get to us, you can get to us. If you forget the code, just call us. You forgot the code. And then if you can't do it in the next 24 hours, this is on special till the end of December.
Yeah, absolutely.
So, and I would say this is probably our most popular month.
For sure,
Everybody's
products.
Yeah, these are.
And if
most
you know
popular.
that it's a product that you love and you use, you can always purchase it and bank it. You don't have to use it right away too. So
Right.
that's
Oh,
another
yeah.
option too. If you know that you're gonna need Radiesse in a month or two, just buy it, prepay for it, and that way when that time comes, you get the special pricing, and when that time comes, you don't have to worry about it.
That's a great point, because we're getting closer to the holidays, and a lot of people don't want to do things right now because they're worried about bruising or something. So get it, and then you can do it in January or February.
Yep.
That's a great way to keep going with your transformation plan or doing your maintenance. So good point. So thank you guys.
Hope you guys learned something new, and thank you guys guys for everybody that participated and asked some great questions.
Oh my gosh, it was
and
awesome.
Yeah, it was great.
It was
So,
awesome. So if you have suggestions on how we should do things, let us know. We are very
We're all
versatile,
ears.
adaptable,
Absolutely.
trainable.
And we want to make this as beneficial to you guys. You know, we want you guys to learn and to feel more comfortable with what we're doing and how things work and why we choose the things that we do. So, yeah, if you guys have any recommendations on how we can just make this better for you guys, more beneficial, then please let us know.
And we want you all sitting in those seats soon. So that will
All
make
right,
it
guys.
really wonderful.
Yes.
So have
Have
a
a great night. Thank you
and
for tuning
happy
in.
holidays. And we'll be announcing the winner tomorrow.
Yeah.
All
Good
right.
luck.
Thank you guys.
So make sure you keep the last few hours to tune into that giveaway. All right. Bye, everyone.
Bye-bye.